Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello friends, this is Dr. Borger and welcome to episode 10 of the Aesthetic Doctor Podcast. Episode 10, I feel like we're legit right now. We've reached double digits. Thank you for listening. I've gotten the greatest feedback from social media, from messages, from Facebook. So I'm feeling the love and I'm sending the love right back out to the universe, to you. I hope you can feel it. So today we're going to talk about IPL, and I'm so excited because IPL is one of my favorite technologies. As I said last time, I have lectured extensively on IPL. I've taught workshops on IPL. I do a lot of IPL, and I just think it's wonderful, 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 and everybody needs an IPL. So IPL, when I say IPL really stands for intense pulsed light. You have maybe also heard it under the term photofacial. That's kind of sometimes what we say when we do an IPL treatment. And what is IPL? What does it do? What are some of the risks? And also, what are some of the principles that underlie IPL? I'm really going to try to keep this easy and low grade, but I love this topic so much that I'm going to have to stop myself from going too much into physics. Like a lot of you know that light energy can induce changes in the skin. So what both lasers and IPL devices do is deliver light to the skin in a controlled manner. We use these devices and the principles that underlie them to achieve a desired clinical outcome. When we talk about laser delivers monochromatic, coherent, co-laminated, and high-intensity beams of light in sort of the principles of physics. IPLs, and this is point one, IPL technically is not a laser. IPL emits polychromatic, non-coherent light in a broad range of wavelengths. IPLs are really used to target pigment in the skin. So when we talk about pigment, what we most commonly think about are melanin in the skin, brown spots, age spots, sometimes the reds, things like rosacea, things like veins, all of the things that kind of you have in your skin that don't make it be a uniform kind of clear color. I live in North Carolina, and everybody gets a ton of sun in North Carolina, especially those of us that are children of the 70s and 80s. Sunscreen and sun protection was not really that much of a rage back then. So we got a lot of sun exposure. And then suddenly, now we're getting freckles. We're getting blotchy brown spots. We're maybe getting a couple broken capillaries. And, our skin is really not that uniform, beautiful, clear kind of complexion that we want. So when you think about what does IPL really treat, the simplest answer to that is really everything that you use your makeup to cover. So if you are using a lot of makeup or you feel like you need makeup because you have differences in skin pigmentation, and IPL would probably be wonderful for you to make those differences in pigmentation in your skin be less. A lot of times that's exactly what I hear. You all know that on a daily basis, I use tinted sunscreen. That's all I use. But some of it is because my skin is pretty even. Again, thank you to IPLs. So I hear that a lot, that people get some IPL treatments done and they get some brown spots removed. They get some veins removed. They get some red blotches removed. Their rosacea is better. Their acne is better. Their age spots are gone, and they're suddenly like, wow, I don't need to do all of this makeup anymore on a daily basis. Yes, I'm all for makeup. Do makeup because you want to, not because you feel so insecure that you can't leave your house without it. So the short answer of what does IPL treat? It's really all the things that you feel like you have to cover up with makeup. My goal is always to A, give you all the answer, but B, to give you all the treatments so that you can let your beauty shine in any way you want without feeling like you have to do anything to cover up something. So the history of IPL really started in the 1980s when a theory was developed that really underlies what IPLs all use. And that theory is that of selective photothermolysis. And basically what they found, these very smart people, was that there's parameters by which light can be used to selectively destroy targets in the skin through the select absorption of light and spatial confinement of the effect. That is really the theory that underlies the majority, all of laser and IPL technology. And what that basically means is that they said, hey, if we hit this brown spot or this red spot or this vessel or this tattoo, depending on the target, X amount of energy for X amount of time, we can destroy that pigment without melting your entire face off. The optical principles that really underlies is the idea that certain things get absorbed by your skin, such as the UVA and the UVB gets absorbed by your skin when you don't wear sunscreen and causes damage. And IPL really is all about absorption. There's something called the Grotius-Draper law that basically says that absorption of light is required for light to exert effects, both beneficial and adverse, like I just said, on tissues. Molecules that absorb light are chromophores. The most used chromophores in the skin are melanin. We already know that melanin is sort of what gives your skin the brown and the pigment. Oxyhemoglobin, of course, what you have in any broken capillaries, in any veins, and any red things, and then water. Thus, with IPL, we dial in the wavelength, we dial in the energy so that we can destroy what we want to destroy while leaving the rest intact. We put enough light, enough energy, enough fluence, enough joules into an IPL. Bam! We fire it at your skin. And then the key is really that the target chromophore, let's say I'm trying to target a little vessel, that thing is bam, zapped, and everything else stays intact. So we destroy that chromophore without destroying the rest of your skin. Not all IPLs are the same. When I say IPL, especially when we talk about technology, it's really about having great technology, and the greatest of all technology in IPL world is the ones that really target closely onto what we want to destroy and don't throw too much other collateral damage out, which means we want to utilize the right wavelength of light because, again, we want to only target, let's say, that little vessel in your skin. And we need to penetrate to sufficient depth. You know, if we're too superficial, we don't get anything done. If we're too deep, you might get other stuff we don't want. We need to get the right pulse duration, meaning the light must be delivered in a period of time that's short enough to prevent the transfer of excessive heat to the adjacent structures, meaning all the stuff around. But we need to do enough light to get to heating up what we want to heat to destroy it. So IPL is wonderful, but you need the right operator, you need the right equipment, like everything else. And this is why you go to a good place. If you've heard anything in this podcast, it is not to go to the Jeep Caravan place where somebody doesn't know what they're doing, but go somewhere where people have expertise, where they even understand this stuff, and where they have good equipment. Because it's the operator and the device together that select the right wavelength, that make sure to get the best parameters for your skin. So number one, you get results because we all like results. results are amazing. And if you want to see my results with IPL, I invite you to go to my Instagram at Dr. Borger. I invite you to go to my website, conciergemedicalarts.com, and just really see what an IPL can do in terms of getting you a clear complexion. You're all going to want an IPL after that. And at the same time, though, we don't want to do any harm, right? I can't use unlimited energy into your skin because I'm going to burn you, I'm going to blister you, you're going to hyperpigment, you're going to hypopigment. And so again, it's the device and it's the operator, and they both come together. It's like in a race car where you need the car and you need the driver. It's all the same, right? It applies to everything in life. So, when we talk about IPL, in its simplest forms, it erases years of damage that the skin has done. So if you want to know what it does, all of that stuff, when you look at your children and they have perfectly smooth skin without any different lights and reds and spots and blotches and all that stuff, IPL does that. It treats reds, it treats browns, it treats veins, it can treat acne. It treats all the different sort of colors in your skin, and it can selectively destroy what you don't want so that at the very end, you come out with a skin that's even complexion. IPL also can have certain attachments and devices that are used for laser hair removal or hair removal, because it's technically not a laser. And, the newer IPLs in studies are actually as good as diodes. The old ones weren't, but the new ones, some of the new technology, there's studies out now that say that they work wonderful. And we've seen them work wonderful in our practice. Because of the fact that we do put energy in the skin, IPL, unfortunately, cannot be used for very, very dark skin types. And we want to make sure that you have not had any sun exposure beforehand, because side effects from IPL really are hyperpigmentation, and we all know that happens more in darker skin types. Unfortunately, you can cause burns, you can cause blistering, and, you can cause some bruising and dyspigmentation. It is important to be honest with your provider, of course, about the sun exposure that you have. This is not the time to say you haven't been to the beach when you have, or you just went on a tanning bed. And realize that not all skin types are safe. We always do the best to be as safe as possible. And it is really a wonderful treatment, especially in a place like North Carolina, where I live, Florida, all of the places where people got a lot of sun historically over their life. IPLs are amazing. So if you have any unsightly veins, rosacea, acne, brown spots, or if really just like every year you want everything bad that's happened to your skin to be cleared up, an IPL is for you. Most of the time we do 3 treatments in a series, and then people do get touch-ups. The ones that get wonderful results, a lot of times they'll come back every year or two and say, hey, look, like I got some couple spots back because I was in Mexico, because I was fishing, because I did blah, blah, blah. And, we kind of zap them and they get that smooth complexion back. They are only for lighter to medium skin types. So unfortunately, it is not for very dark African-American skin. And the reason being is that there's too much melanin inherent in very dark skin so that the laser almost can't see the difference. And then realize, obviously, that depending on what kind of pigmentation you have, on average, we say it's 3 treatments. You'll see an improvement with each treatment. Sometimes it'll take 2, sometimes it'll take 3. And like everything else, if you have either a lot of pigmentation or stubborn pigmentation, depending on your tolerance, depending on the color of your skin at baseline, once in a while, we need an extra treatment. IPL is really one of those wonderful treatments that gives people their confidence back, because it does make some imperfections in your skin disappear. And it is really after an IPL a lot of times that people see what their lightest and brightest skin can look like. We love the IPL device that we have. We have the Nordless from Candela. And what the Nordless from Candela does is it's an elliptical IPL, which meaning it really focuses the energy in an ellipse right around the target that we want to hit. So we get amazing results because we're able to put all the energy that we want in a very narrow wavelength around our target wavelength and not scatter all this other light that the old IPLs used to scatter that gets absorbed in your skin and causes adverse effects. I talk about IPLs to professionals for hours. I could talk to you for hours, but that is really my introduction to IPLs. Reds, browns, sunspots, age spots, acne, rosacea, so much more. My IPL, I think, has 30 different indications, and I just keep repeating the most common ones that we use. But if you have any questions on IPL, as I said, I could talk about this for hours. They are wonderful to undo some of the damage that has happened through being out in the sun and the environment over time. And this is episode 10 of the Aesthetic Doctor podcast. Next time, we're going to talk about Botox for hyperhidrosis, meaning Botox for excessive sweating. And we'll mention a little bit about some of the other technologies for excessive sweating that there is. I just got a wonderful question by a patient on it. I actually do it in my office, and I haven't talked about it in all of my previous Botox episodes. So I figured we'll go all in on Botox and all of its uses. And I will see you next time. Have a wonderful, fabulous week, my friends. As always, I welcome your questions, your likes, your suggestions. Be well and wear your sunscreen. Bye-bye.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.